As men age, their bodies require a little added attention for optimal health, and well-being, excuse me. Now, unfortunately, a lot of men don't get this because they don't seek medical care when they need it. Well, today we're going to share some tips and tricks on men's health, as well as answer your healthcare related questions here on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, and welcome to Ask the Doc, no appointment needed, the show where medical experts like myself answer your healthcare related questions. My name is Dr. Kamaljit Kaur, and I'm a double board certified primary care physician here in beautiful South Florida. So let's get right to our questions. And this first one comes to us from Jake, who emailed us and asks, I have been feeling blah for a while now, always tired, low energy, and no interest in sex, which has never been a problem before. I know I should see a doctor, but I am always hesitant to go. My wife says it could be low testosterone. Help! Jake, it is so important for you to know that you're not alone. Before I dive a little bit more into this, let's watch a very informational video from our friends at the Mayo Clinic about low testosterone.
Testosterone is a key male hormone that is responsible for characteristics like hair growth, muscle mass, and deepening of the voice. As men age, testosterone levels gradually decline, particularly over 40.
The main complaint I see as a urologist is a lack of interest in sexual functioning. But fatigue, changes in mental acuity, less stamina, and very often mild degrees of depression are associated with a falling testosterone.
In some cases, infertility can be tied to low testosterone, but presenting these symptoms or traits is not an automatic diagnosis.
Not all men need testosterone. It's very important that this diagnosis is properly made. It's made based upon symptoms, but also the actual blood level, the serum level of testosterone.
When it comes to treating low testosterone, the most common way is a cream applied to the upper arm, but injectable or pill forms of testosterone are also available.
What you should notice is that within 48 to 72 hours of your dosage, that your desire has improved.
For the Mayo Clinic News Network, I'm Alex Ositis.
That was a great video with a lot of wonderful information about low testosterone. Before I move on, though, I want to remind everyone what exactly is testosterone. We hear about it all the time, and majority of us are familiar with it. Testosterone is the major or the predominant male reproductive hormone, and it's responsible for a variety of mechanisms in the body. As the video showed, it is primarily responsible for a man's sexual health, and that's commonly how we know about it and associate it. But there's a lot of other mechanisms in the body that testosterone is responsible for. As the video mentioned, muscle health. Now, maintaining muscle and growing muscle has a lot to do with so many things, what you eat, how many times you work out, and your baseline muscle mass. But testosterone has a huge role in playing a part of growing that muscle and maintaining it, especially as a man ages. Also, did you know that testosterone has its hands in producing red blood cells? Now, red blood cells have their own functions in our body, one of them being carrying oxygen to different parts of our body so that our body can work at its best. So if you're having low testosterone, you're probably not producing red blood cells the way you should be. And because of that, oxygen isn't getting in optimal amounts to the parts of your body that it should be getting to. And because of that, you may not feel your best or work at your best. The other thing that's really important to know about testosterone that I think is quite underrated is how it can impact your mental health. As the video mentioned, mental health can be severely impacted by low testosterone. Actually, it can show up in depression in men as well. Also, we've seen that testosterone has a huge part in regulating a man's cholesterol levels and overall heart health too. So as you can see, there's a lot that testosterone does in the body. And If you're low in it, it can show itself in a lot of different signs and symptoms, some of the ones that you may be experiencing. So it's important to get tested. And it's also important to know that even though these symptoms that you're experiencing can be largely due to low testosterone or dysfunction in your testosterone mechanisms, it can also be due to other diseases in the body. For instance, thyroid imbalance can cause some of these symptoms as well. So it's very important to discuss what you're feeling with your primary care physician so you get that personalized recommendation, you get to the root of the problem, and you can treat it properly and live a long, happy, and healthy life. Let's get to our next question. This one comes to us from Olivia, and Olivia emailed us asking, my husband is a great man who would do anything for his family. We have been married for 22 years, have 3 great kids, a beautiful home, and he has held the same job for 15 years. But lately, I worry about his mental health. He seems depressed, stressed, and overwhelmed. He is so full of pride, he won't admit he needs help. What can I do to help him? Hi, Olivia. Thank you for sending us this question. I see this very, very commonly in my male patients. Honestly, men often see themselves as the rock of the family, and they avoid expressing their inner worries, thoughts, emotions, or even symptoms in the fear that they're going to appear vulnerable or unable to take care of their loved ones. And it happens all too often. While this can be seen as admirable because I know this is coming from a good place, it can actually be quite detrimental to a man's mental and physical health. I think one of the best things you can do is help him by having an open dialogue about this, expressing your concerns, but also expressing your appreciation for all that he does for you and for your family and for his loved ones. And then gently let him know that you're concerned, and you're concerned because this might be affecting his health. I suggest trying to avoid any language that might make him feel like he's coming up short or there's something wrong that he's doing, because you never want to be confrontational when expressing to someone that something that they're doing may be negatively impacting them or their family. Then I suggest maybe taking him to see his physician or encouraging him to go on his own. A lot of times, as a primary care physician, I have men come in with their wives. As a wife, I've done it to my husband. So, whatever it is that you guys are comfortable with, either him going alone or you going with him for support, I think getting him into his doctor's office to have that discussion candidly with his physician is a great place to start as well. Because then you can really start getting into the nitty gritties of why he's feeling the way he's feeling and what can be done to help, and what can be done to help, excuse me, keep him going, keep him being the rock of your family and being happy and healthy. Let's get to our next question. This one comes to us from Gina, and Gina reached out through Facebook asking, my husband has put on a lot of weight lately, all around the belly. He says it happens to everyone and I shouldn't be concerned, but I know belly fat is dangerous for his heart. Can you share some things I can tell him? Thank you for your question, Gina. This is a tricky one in that approaching it may sometimes come off as offensive, so we want to avoid doing that. But as with my advice to Olivia in the last question, you always want to do it in a loving manner while expressing that your main concern is for his health and to keep him healthy. When it comes to belly fat, it's also important to make a note of what's considered normal, right? And this is a little bit nuanced, a little more nuanced than I'm going to explain in just a second, because it really depends on what your overall weight is, your height, your BMI, your other health risk factors, and all of that. But generally, for a man, a waist circumference of 37 inches or less is considered normal. When it starts to go above 40 inches, then that's when we consider it to be high risk. And belly fat, which we commonly call visceral fat, is particularly dangerous because it's inflammatory. It increases the level of inflammation in a lot of your organs, and that increases your risk of insulin resistance or developing diabetes, developing heart disease. Blood pressure increases, even increases your risk of stroke and dementia. And really, not lastly, and definitely not leastly, it can actually increase your risk of some cancers too, like colon cancer, which we've already seen a rise of in the United States recently. I suggest reviewing some of these facts with him and encouraging him to think about how this relates to his own health and how he can move forward to be a little bit more healthier. Knowing how negatively certain things that we're doing or that we have affect our health sometimes is motivation for us to start doing things the right way or the healthier way. For instance, eating a whole foods plant-based diet and avoiding processed foods can certainly help reduce that visceral or belly fat and improve his overall health. For more personalized recommendations, I do suggest reaching out to a board certified lifestyle medicine physician to really get into the nitty gritty and maybe come up with a detailed plan for your husband and maybe even for your family. All right, these are great questions, and we want them to keep coming in for you to keep sending them to us. So here's how you can send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes to us from Terrence, and Terrence writes, I am 45 years old and work 55 to 60 hours a week. I eat on the go, don't exercise, and now have been diagnosed with prediabetes. Help! How do I get my health back on track? Hi, Terrence. Thank you for sending this in. This is a great question because I see this scenario in my own practice at least once a week. In fact, I saw it just yesterday, almost exactly. Now, when it comes to busy lives, we're all leading them now, right? And it's very difficult because of that busyness and being stressed all the time and being spread thin, really. It's difficult to stay on track with our health. And unfortunately, we start to put our health on the back burner, which we shouldn't, but I understand that it's easy to do. The first step in getting back on track, I recommend, is reminding yourself of why it's so important. Yes, work is very important, and the people that we serve through our work deserve our best. We want to be firing on all cylinders and be excellent at our jobs, no matter what that job is. But you can't pour from an empty cup. And that's so important to know because if you're not at your best, how are you going to provide and do your best at work, right? You need to be at your best physical and mental health. Let's not forget the mental health component of it. Whether it's professional or personal, whatever you do, you want to do it with excellence. Now, once you realize that, it becomes easier to incorporate healthy habits into your daily routine. For instance, many people find it easy to start with their diet and exercise regimen. I know it probably sounds daunting, but if you take it step by step and you incorporate small changes here and there, it becomes easier to sustain and maintain that as a healthy lifestyle. So if you're eating out a lot, I suggest maybe choosing healthier options. Heck, a lot of fast food chains nowadays have healthier options. They have salads of different kinds. They have an option for meat that is more lean, more grilled than fried options, and sometimes even veggies they have. So try to avoid the processed meats, the fried stuff, French fries, for example, and opt for maybe a chicken salad, a grilled chicken salad. The other thing to remember, as I mentioned, is do this gradually. Rome wasn't built in a day. You don't want to force yourself or put pressure on yourself to do everything at once because that can actually backfire. If you tell your body and your mind that I'm going to change everything in one day and tomorrow morning it's going to be all new, that's actually a lot of pressure that you're putting on your mind, which is probably already stressed from work. So you want to do it slowly and gradually. And if you change one thing about your lifestyle every few weeks, your mind will turn it into a habit and it becomes a daily habit. And then as time goes on, it just becomes a new lifestyle for you. And really, that's the way we encourage people to do it rather than I'm going to wake up tomorrow and follow a keto diet or follow a low carb diet or, the Mediterranean diet even. It all takes time. Same thing with exercise. If you're somebody who doesn't exercise at all, we, your physicians, don't expect you to become a triathlete by the weekend. So, doing small things like a 10-minute brisk walk after dinner, even that could be quite beneficial. And also, it's good to just kind of relax at the end of a very stressful day. I love that you're already on track by asking this question and encourage you to think of more things that you can do slowly to get you even healthier. Best of luck. Okay, we just got a question from Nelson, and Nelson reaches out from Facebook. Thank you, Nelson. And he asks, my father and grandfather both had prostate cancer. Is there a genetic connection? And if not, what else puts me at risk? I'm in my 30s and my doctor wants me to consider having prostate exams as part of my annual physical. Nelson, thank you for writing. This is such a good question because it's such a common question. Now, before I dive into it, let's watch a video from our friends at the Mayo Clinic talking a little bit about prostate cancer.
The prostate is a small gland that is involved in reproduction and makes some of the essential components in semen. While it is small, it has an important role in reproductive health and can cause voiding or urinary symptoms as men age, as well as becoming a source of cancer. Like other kinds of cancer, prostate cancer starts when cells mutate. These small changes in DNA cause the cells to grow faster and live longer than they normally would. As these abnormal cells accumulate, they monopolize resources from normal cells, which can damage surrounding tissue. These cancerous cells can then spread to other parts of the body. By definition, prostate cancer only affects bodies with male reproductive organs. But in addition, there are some other risk factors that we can monitor. Age is a big one, as prostate cancer is more prevalent in older men, which is why testing is encouraged as men age. For reasons that are unclear, Black men also have a greater risk compared to other races or ethnicities. Being at a higher weight is another possible risk factor. Genetics can also play a role in prostate cancer. A family history of prostate cancer or certain kinds of breast cancer increases the likelihood of being diagnosed with prostate cancer.
As you can see, prostate cancer can be quite a health concern for many men. In fact, statistics have shown that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. As a reminder, and as the video mentioned, the prostate is a reproductive gland in men, and it sits just below the bladder around the urethra. Cancer of this gland can certainly have a genetic component. And in fact, many prostate cancers, or many men who have been diagnosed with prostate cancer, are individuals who've had a strong family history of this, which is one of the things as a primary care physician that we screen when we do the annual checkup in men. Do you have a family history of prostate cancer? And if you do, who was it? Because if it's a first-degree relative, like a father or a brother, then that greatly impacts your chances and your risk and what we should do in order to screen you. While there are a few different genetic mutations that are risk factors for this disease, one of the most common ones is the BRCA gene. Now, I know a lot of people associate the BRCA gene 1 and 2 with breast cancer for women, but this also has some implications for prostate cancer in men. Now, there's not formal testing recommendations for this in majority of men, but in individuals who have a strong family history, there are some guidelines for doing genetic testing, and this is something you certainly want to talk to your physician about. Other than genetics, there are other risk factors that may contribute to your chances of developing prostate cancer. And some of these are similar to what the video mentioned. Age. As with most cancers, your age and increasing age increases your risk of prostate cancer, especially after 50. Ethnicity is also important. For instance, men of African, African American, and Caribbean ancestry have a higher risk of prostate cancer. Your diet, I know I'm always talking about the importance of a healthy diet, and it can certainly affect your chances of developing prostate cancer as well. A diet that is high in red meat, processed foods, and that's low in vegetable and natural fiber can actually put you at risk for prostate cancer as well. Smoking. Smoking has been associated with so many diseases, heart disease, diabetes, heart attack, strokes, etc. But it's also highly associated with your chances of developing prostate cancer. Not regularly exercising or being sedentary for a majority of the time can increase your risk of prostate cancer as well. And then regular alcohol intake also increases your risk of prostate cancer. So as you can see, there's a lot of lifestyle factors in addition to the genetic factors. And you know, you may be positive for certain genetic mutations. You might have a strong family history, but if you're living an overall very healthy lifestyle, that does lower your risk of developing prostate cancer. Just because you have the genetic mutations does not always mean it's 100% that you're going to develop this cancer. I suggest talking to your physician about this in detail so you can stratify your own risk and see what is the most appropriate way to proceed with screening for yourself. I hope you do well. All right, these are great questions, and I love that you're sending them in. But if you don't get a chance to have your question answered with us today, there is another way to get it answered. Ask Hanna. This is our service where you send in your question and board-certified nurses help you answer it.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
So this is exciting. We just got a fresh new question from a viewer named Patrick, and Patrick reached out to us through YouTube asking, my mom had breast cancer, so even though I'm a man, should I get a mammogram? This is a wonderful question because this does come across my table a lot as well. Now, when it comes to breast cancer, majority of us know that there are formal guidelines that are almost written in stone, almost, when talking about screening women and when a woman should get screened, what she should be screened with, how often she should be screened, and what to do with those screening results. Unfortunately, when it comes to preventing or screening for breast cancer in men, it's not so clear cut. We don't have enough studies yet to validate the fact that we should be doing mammograms in every man starting at a certain age, like we do for women. But as with my previous question about prostate cancer, it's always important to talk to your doctor about what your risk is. So your mother, you mentioned, had breast cancer. Were there any genetic mutations that were associated with her cancer? Should you be tested for those genetic mutations? Are you personally at a higher risk due to lifestyle factors or other health conditions? And if so, what's best for screening for you? Is it a mammogram? Is that possible? Is it a MRI, a breast MRI in particular? Is it a breast ultrasound? Or is just blood testing to test for genetic mutations enough? It's a very detailed question that requires a lot of different factors to give you your personalized answer. Thank you so much for sending the question in, and I hope this encourages you to talk to your doctor about how to proceed. All right, let's get to our next question. And this one comes to us from Edwin. And Edwin reached out to us through Instagram asking, I can't believe I am writing in about this, but well, I am really upset because I feel like I'm not the same man I once was in the bedroom. My doctor said my issue may not just be a sexual problem, but can actually be a cardiovascular issue. I had never heard of that before. Can you explain what he meant by that? Hi, Edwin. Thank you so much for your question. And I really want to applaud you for sending this in because I know it's a real personal question, so it may not be easy to ask sometimes. I thank you for sending it in to me and do encourage you to talk to your doctor about it too. Now, while the first thing we think of when a man tells us that he's a changed person in the bedroom and not for good, usually we think it has something to do with his reproductive health in origin, like that's where the problem is, or something to do with his genital or anatomical abnormalities in that region. But cardiovascular disease is probably the first thing a lot of us physicians think about, because the theory is that if you're having erectile dysfunction or issues in the genital region, then that may be due to reduced blood flow in that region, and that may be due to a buildup of cholesterol. And if you have a buildup of cholesterol in arteries that are as small as the one in your genital region, then you may even have a buildup of cholesterol in the heart arteries. And I know it may be difficult to understand, but that's the reason why we as physicians think that might be the first thing that we want to investigate for, rather than just focusing on what might be going down, particularly in the pelvic region or your genital region. So yes, your doctor is very, very right to think about that and to talk to you about it, educate you on it. And then maybe the next thing you want to do is talk about, well, what can I do for screening, or what can I do to assess my cardiovascular health and the risks associated with it? Because again, we always want to get to the root of a problem, right? Having erectile dysfunction or having inabilities in the bedroom that you didn't have before may be a sign of a greater underlying disease. And it's that disease that needs to be targeted in order to get appropriate treatment and to continue living a long, healthy, and happy life. Well, I think we had some great questions today, and they ran the gamut of men's physical and mental health. Thank you so much for sending them in, and I look forward to seeing you here next time on Ask the Doc, no appointment needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.